Unpaid loans and unearned salaries by health workers currently on exodus make up a chunk of irregularities of the Health Ministry and the Ghana Health Service when they appeared before the Public Account Committee Tuesday. The ministry took turn at the committee to answer questions on violations pointed out in the Auditor General's report for 2022. It also emerged that at least 3 of these health workers have been referred to the Economic and Organized Crime Office, EOCO, and INTERPOL to assist with retrieval of the funds. My colleague James Aveji was at the committee sitting and filed this report.
The Ministry of Health and the Ghana Health Service appeared before the Public Account Committee on day 2 of the committee sitting. Procurement breaches, unearned salaries, and unserviced bonds were some of the several irregularities cited in the Auditor General's report for 2022. Now, in an instance involving the National Blood Center, Chairman of the committee, James Aveji, referred management of the Blood Center to the Attorney General for prosecution over some 130,000 procurement breaches.
The next infraction is uncompetitive procurement. So there is a challenge at that office,
yes,
where we are doing restrictive tendering without seeking approval. If you want to do procurement, instead of looking for at least a minimum of 3 invoices or quotations, that one too you fail to do. And this one, we don't have any option than to refer you to the Attorney General for prosecution. So we are doing our part. You have breached the procurement law. So when you are prosecuted, the judges will take a decision on that. So clerk, take note on that.
Member of the committee and member of parliament for North Diroxin, Nelson Dapamekpo, who was clearly not happy with several of such procurement breaches that characterized the sitting today, requested that the chairman as well as the Ghana Audit Service get a bit tougher with punishment to such offenses, including prison terms.
For me, even the rectification doesn't resolve the issue. So you need to take this matter seriously. It appears that procurement breaches are simply being glossed over and being treated with kid gloves. It's a serious provision that should guide you. So, Chairman, even the auditors, in giving recommendations, they should have recourse to this provision. Thank you.
Yeah, we know they've been making a recommendation that the sanctions under the law should apply.
It also emerged at the sitting today that apparently some nurses or health workers who have left the country to seek greener pastures or to further their education outside the country have left with loans and unearned salaries which they haven't paid. The Director General of the Ghana Health Service, Dr. Patrick Kumar-Boaji, explains how they are trying to retrieve some of these monies.
Damien Inso Ayeni is currently, we believe, is in China. We managed to reach him. It's not paid. So we tried to place embargo on the guarantor's salary, but the court is demanding, the bank demands a court order, and we are working on making sure that we retrieve the money from the guarantor.
Okay. Unfortunately, we never get anything in writing from them.
So when was the last time you visited them? So that you're able to respond to this question intelligently.
Sir, I have to confess, it was last year.
Last year?
It was last year.
January or February or December?
Around November. I don't have the exact date.
And what is the update from EOCO?
There's nothing specific for. Sorry, I have to find the right words to say.
So when you say they are making effort to resolve this thing, it is not true.
Okay, then I suppose what I meant to say was that we have reported the matter to EOCO.
Before all of this unfolded in the early hours of the sitting, a spectacle actually happened when the Minister of Health as well as his 2 deputies were announced to be absent at the sitting.
And also the minister is not here. We have colleagues who have contested this election and they are here. If they have lost, there are people who have lost and they are here. 2 of the deputies lost, that's fine. But it doesn't mean that they shouldn't work. Are they resigning? And if they're not resigning, they should be here. So I don't think that that's a good excuse. Because they have gone to contest elections, they are unable to come. I mean, you should get a different excuse. And the worst of it is that the chief director is not here. I mean, you're not taking us serious.
Chairman of the committee, James Kluchi-Aveji, interceded in the situation as he urged the members to calm down and ordered proceedings to. Chairman of the committee, James Kluchi-Aveji, interceded in the matter and urged members to calm down as he ordered that the sitting or the hearing continues even in the absence of the ministers. So far as the DG for the Ghana Health Service, Dr. Patrick Kumar Boaji, and the director from the Ministry of Health are sitting in for the ministers. The committee resumes tomorrow to continue with hearing of the directives in. The committee resumes on Wednesday to continue with the proceedings.